Today I'll be talking on a mental health issue called as depression. I'm sure you have heard this word depression. Lot of people have lot of misconceptions about depression. There are people who even joke that depression occurs only to Bay of Bengal, not to human beings. But please understand, depression is a medical issue. It is as much a medical issue as diabetes, hypertension. It is a medical issue which can create lot of problems to the person who is suffering. So depression doesn't mean that depression, when we say that particular disease, depression, when we talk about it, it doesn't mean that it will be there for just 1 day, 2 days. No. See, normal mood lowering can occur to anybody. But this normal mood lowering is not depression. Something which occurs for a period of at least 2 weeks. There is a lowering of mood. I'll be also talking about other symptoms. And there will be loss of functions like social functioning, occupational functioning. That is where we call this particular term called depression. In fact, 3 different words you should remember. When we diagnose depression, the symptoms will be pervasive throughout the day. They are persistent and there are wide range of symptoms. So it is not 1 or 2, just crying once or just feeling sad once. That doesn't qualify for this word depression. So there are a lot of symptoms. The person, he starts having negative view of self, negative view of past, negative view of future, feels worthless, feels that he is incapable, tells that he is feeling guilty, feels sleepless, and there is a sudden change in mood. Morning he doesn't feel like doing anything, by afternoon he is better. He often complains of loss of energy, he complains of impaired concentration, and his work ability is impaired, his social functioning is impaired, and he becomes slow. Others observe that he is very slow in his day-to-day activities. In fact, we psychiatrists call this as psychomotor retardation. They become pessimistic. They think that it is better off that we die. They also have repeated thoughts of suicide. They take action, they try to attempt suicide. And there are times where they start believing that they are having some physical illness. They feel that they may be suffering from a disease like HIV or cancer or some other physical illness, and they start worrying about it. Doctors tell them that there is nothing wrong with them, but they do not listen. So actually for others who are there with them, it becomes ununderstandable. Like what happens is, why is he behaving like that? Why is he doing things like this? So many a times there is no cause, because when I tell patients that your patients or their relatives that you have depression, they tell me, no, how can she be depressed? How can he be depressed? We have no financial problems. He is so fine. See, please understand this. There is no relationship between any, it is not a must that any stress only will cause depression. Depression can occur endogenously. It can occur suddenly. And please understand, there are depressions where due to some stress, depression can occur. That is, there is some loss, maybe financial loss, or they might lose a relative, or there is a stressful life event. They fail in the exam, or they lose all social support. They have been defamed and somebody has put a false allegation against them, and after that even their wife, their parents, everybody they are all against the person. So there is sudden loss of social support, or there is some incurable physical illness is diagnosed, say cancer, or say HIV, or say epilepsy. So these are diseases. In fact, now there is good treatment for HIV, cancer, all these diseases. But these patients, they don't know about it. They start feeling that's the end of life. then of course please be aware that this can run in families. Depression can occur due to familial factors, genetic factors. It is basically this genetic vulnerability, the familial factors, all these lead to some chemical changes in the brain, and because of these chemical changes patients start developing depression. So basically what you should understand is this is a medical illness just like hypertension and diabetes, and this disease is due to some chemical changes in the brain. Please understand this. I again repeat this. In fact, studies after studies have very clearly pointed out that the brain of patients with depression, they have identified even CT scan, MRI findings, and also PET scan findings which say there are changes in some chemicals, there are changes in the blood flow in the brain. So this is as much a medical illness just like hypertension and diabetes. So what you should understand is we will have to see, patient says he has sad mood. How bad is it? How long has it been going on? Have they lost interest in things they found it as very pleasurable? Are they more tired than usual? These are certain questions we psychiatrists ask. Then we ask them whether they have lost confidence in themselves. Do they feel guilty about things? Do they have concentration difficulties? Do they find it difficult to sleep early, or do they get up early? That is, they sleep at around 10 o'clock. There is early morning awakening. They have lost their appetite. They have lost their weight. In fact, significant weight loss. That is almost around 3 to 4 kgs in a month. 10% to be precise, 10% of weight loss in 1 month. Do they feel that life is not worth living? So these are certain questions we psychiatrists ask. This is because according to our criteria, I would mention to you, we go by certain criteria to make a diagnosis of depression. This is what is called as the International Classification of Diseases. In this, sad mood which is pervasive, that is throughout the day, anhedonia means loss of interest in pleasurable activities, anergia, feeling tired, these are the major symptoms. In this, at least one symptom should be present to say that particular person is suffering from depression. Then of course there are a lot of minor criteria like loss of self-confidence, decreased concentration, then sleep disturbance, loss of appetite, feeling of helplessness, worthlessness, pessimistic ideas of future. So in this, at least 3 to 5 symptoms should be present to make a diagnosis of depression. So we in fact quantify the depression into mild, moderate and severe based on these criteria. So please understand this. Many times there are low grade depressions where they are lifelong mild fluctuating depressions. Then there is what is called as a bipolar depression. Maybe in future I will be giving a small lecture on what is called as bipolar disorder. Then I will tell you about this. So basically what you should understand is in depression, if a person is suffering from depression, 50% of patients may not understand that they have depression, and in fact 10% of those who attend primary health care, government hospitals, they will be having clear-cut depression. And what you should understand is this is something which can occur in younger people, it can occur even in children, and in fact research says that it is more in men, less in women. And of course, if it is not treated properly, it can lead to suicides. Many of them will have physical illness and also depression. And in fact, 12%, almost, this is quite a big number, become chronically depressed. And what you should understand is 50% of depression diagnosis is missed, and it is recognized subsequently, 10% of it. And another problem is many times it remits on its own. Depression remits on its own. So people think that, oh, he was dull for a few days, he became better. But those who remit, after 6 months they can have a relapse. So basically, depression is often missed because many times it can present with only bodily symptoms. Somebody who goes from doctor to doctor saying that he has a stomach ailment, they do endoscopy, nothing is there. They do all sorts of tests, nothing is there. But he goes on talking to doctors, and basically what happens is doctors many times miss it out because they will not be knowing much about the other symptoms of depression. Neither the patient tells them. There is a lot of stigma. If a doctor tells you, you go to the psychiatrist, you get angry. And of course there are times where even doctors miss out. See, doctors what happens is they will be in a busy setting, so they treat the symptoms, maybe the physical symptoms, and in fact research very clearly says doctors are not, sometimes doctors miss out on making a diagnosis of depression. So this is a very important disease. Please understand this. Any one of us can have depression, and depression requires treatment. Depression is diagnosed scientifically by a psychiatrist. So this is a channel which is a new initiative of One Good Step. Along with Dr. A.V. Badiga Memorial Hospital, our main aim is to bring to your doorstep clinical features and treatment of various psychiatric illnesses. But let me tell you, this is no substitute for medical consultation. Please go seek help of your doctors. If you are feeling depressed, talk to a mental health professional. Please understand, a problem shared is problem halved, a problem kept in mind is problem doubled, and please understand that it is a neurochemical illness which requires proper treatment. I will be talking about treatment of depression in next week. So if you have any questions, please put it in the comment box. Our main aim is to see that mental illness related awareness is brought to your doorstep. And I will tell you, please understand, the first thing is you are now getting aware, then accept if you are having any of these symptoms, analyze whether you need treatment, take action. Thank you.